Present day, people are suffering with many urological problems. It may be just blood in the urine, or a problem of abdominal pain because of the kidney stones, or somebody having a urine leak issue, or somebody a major issue like a kidney failure requiring renal transplant. All of us do get lots of doubts about these particular issues, and I would like to address a few of these issues today. I am Dr. Srinivas Gutta, consultant urologist and a transplant surgeon at Yashoda Hospital's high-tech city. Now, one of the questions what I received was, what are the chances of needing a surgery if my body rejects a new kidney? Rarely this happens, a body rejecting the kidney, because present day we have lots of good medication to prevent rejection, but still there is a possibility in a few of them. So if at all, if a kidney rejects and if we are not able to make it work again, we need not remove that kidney immediately. In some instances, very few instances, a rejected kidney has to be removed because it becomes very painful and there is a lot of blood coming in the urine. In those situations, they need another surgery to remove the kidney. But otherwise, a patient who has undergone a transplant once and the kidney got rejected, if you are talking in terms of a second kidney transplantation, yes, always it is a possibility there. You can get a second kidney transplanted if your first kidney gets rejected. Okay. And now regarding blood in the urine. So is blood in urine a sign that I will need a surgery, or is it nothing to worry about it? Blood in the urine definitely is an ominous sign. Everyone should be concerned if they see blood in their urine, because blood in the urine can be due to simple problems like an infection or a small stone passing off. But at the same time, the same blood in the urine can be an indicator that there is something grossly wrong in your kidneys or in the urine bladder or in the prostate, because cancers of the kidneys and the bladder are usually present with the blood in the urine. So if you have a blood in the urine, definitely you need to see a urologist and do a thorough workup. And another question I got here is about, why do I leak urine when I cough or laugh? Is the surgery only solution? The condition what you mentioned is called a stress urinary incontinence, in which a person, whenever there is a rise in the intra-abdominal pressure, they will have urine leakage happening. So this condition called stress urinary incontinence, if it is mild, we can overcome that with a few medications and with exercises. But if the problem is quite serious and it is quite significant and they are losing significant volumes of urine every day because of this problem, then a small surgery, a daycare surgery will correct this particular problem and cure them of this particular problem. And coming to, can't the kidney stone just be crushed instead of being surgically removed? This is another doubt somebody is having. So present day, we are not doing any major surgeries for kidney stones. It's all minimally invasive surgeries, effectively passing the smallest possible scopes through the natural urine orifices under anesthesia into the kidney, and with the help of lasers and the miniature scopes, we are powdering, making them into dust, so that all this dust passes off in the urine without any pain or problem. So effectively, the treatment of kidney stones has drastically changed, and nobody needs a cut for removing the stones in the kidney. When regarding health related issues, if you have any problem, any doubt, anything in your mind can be cleared through Google questionnaire. And Yashoda is always ready to answer. Thank you.